Until recently, British Columbia's healthcare system, designed largely in the 1960s, was structured around the needs of hospitals and healthcare providers, with medical staff regarded as the experts and patients as recipients of information and instruction. This approach to healthcare is no longer sustainable. Now, and over the past decade, healthcare leaders have been striving to address rising healthcare costs, an aging population, an overburdened healthcare system, limited tax dollars, and patients wanting to play a more active role in healthcare redesign. Current research shows when patients develop ever-increasing knowledge of healthcare and take command of their own healthcare at home, all of us can succeed in improving the overall population's health and in lowering costs. In 2007, the British Columbia Ministry of Health took strides to make system-wide improvements. With a multifaceted strategy contained in the Primary Healthcare Charter, the idea of partnering with patients was endorsed as a transformational approach that would empower patients, provide engagement training for patients and providers, develop policies and supports to implement a patients as partners systems approach. Starting from a place where there was no coordinated engagement activities, no avenue to harness the patient's voice, and no shared leadership vision or a supporting infrastructure, the Ministry of Health Patients as Partners program quickly moved to providing leadership, strategy, policy, collaborative efforts, and funding. Execution through coordination, training, engagement activities and mechanisms, partnerships, education, and the development of tools and resources set the foundation to achieve healthcare cultural transformation.
On behalf of the BC Ministry of Health, I want to express my sincere appreciation to be honoured with the International Association for Public Participation Canada's Core Values Award for the Organization of the Year. Over the past 9 years, I'm proud to say that we've seen countless examples of improvements in the system by involving patients and families in the decision making, and such examples as building construction, acute care services, surgical services, and primary care services. Having patient voices at the table made a difference.
One of the things about healthcare in the past is that it was designed by bureaucrats and doctors. At least that's how I see it. Now they're asking for input from patients who are the end users of the system. I've been on committees where I've sat with dozens of doctors and bureaucrats too. They've got to be involved one way or another because they're the people in the end that have to dole out the money. And they're listening. They want to hear what I have to say. I get choked up a little bit about it. It's something else.
In less than 10 years, close to 800 healthcare workers have been trained, resulting in common understanding, language, and knowledge of best practices in patient and public engagement based on IAP2 principles. As well, close to 40,000 patients have been engaged, resulting in improvements to healthcare at the individual, community, and system level.
The Ministry of Health will continue to engage the public and partners in the improvements that we need to make to ensure a high-quality healthcare system in British Columbia.